Hello, my name is Eileen. I've been an RN since 1979. My field of specialty was cardiovascular ICU. I'm doing this video for my 5 adult children and for my grandchildren. This is the hydrogen peroxide protocol our family uses every day, and it's for respiratory hygiene and prevention of illness. I have a history of respiratory problems. My Achilles heel is my respiratory tract. As a child and into my 30s, I would get frequent chronic bronchitis. When I was, I would say about 6-7 years ago, I had severe Lyme disease, which left me bedridden for 2 years. And I also have other autoimmune diseases. So I found out about this 2 years ago and have been using it every day since then. Last winter, I got no infections at all. No flu, no viral infections, no respiratory infections. And when my in-laws moved in last year, I started them on it because they both had compromised respiratory systems. And my father-in-law particularly coughed all the time. Since instituting this, he has stopped coughing entirely at night, and throughout the day, it's decreased a lot. So one thing you need to know is that viruses are not alive, unlike bacteria. Bacteria are live cells that you try to kill. Since viruses are not alive, you can't kill them. Their mode of action when they come into the body, they're actually genetic material. They come into our body through whatever route, and they begin to attack cells. They get into the cell. Once they get into the cell, they deposit their genetic material and they infect the cell. They reproduce inside the cell. And from there, they go to another cell and they get into that cell, deposit their genetic material, and reproduce and infect that cell. And that's how a viral infection is spread. So this protocol uses a very dilute solution of hydrogen peroxide with sterile saline solution. And the hydrogen peroxide, the chemical name for it is H2O2. The extra oxygen in there is what goes in and destroys the infected cells so that they can't go on and infect more cells, more healthy cells. So I'm going to show you how to do this. It's a very inexpensive treatment. You can do it home. Anybody can do it. As I said, my 80-something-year-old in-laws did it with very good results. Myself, I have also, I don't know if I mentioned autoimmune diseases, and my Achilles heel is my respiratory tract for a lot of infections. So this has been very beneficial for me. You can also, children, you can have your kids do this. It's good for everybody. So the first thing you need is a micro-mist nebulizer, which is about $22.50. Hydrogen peroxide solution, which is 77 cents. A sterile container of 250 cc's of normal saline solution, or chemically it's called 0.9% sodium chloride. And your mask, a clean teaspoon. We order everything from a company called mountainside-medical.com. It's a company that is run by veterans, military veterans. There's no price gouging. They had the best prices I've found on all my medical equipment. And I looked this morning online, they have a 2-week delay in deliveries now. Normally they would deliver within 3 to 5 days, but because of stock and trucks and things like that, they're behind 2 weeks. So the prices I mentioned were from their site. So the first thing you would do is open up your nebulizer. It comes with a package with a mask, an adult mask, and other attachments. And I'll show you what to do. Empty everything out. Here's your tubing. Both ends are exactly the same. They're just connectors. One connector goes into the top of the unit. You pull out the adult mask. It also comes with a pediatric mask. So if you have one child, you're golden. The other thing is, the adult mask is here, and then there's a chamber here to put fluids. You attach the adult mask like this. You put the bottom connector on right below the clear chamber. Now we're going to put this aside for a minute. You don't need this. Now here's how you mix up your solution. You'll notice that the saline is sealed. That's why it's sterile. If you have fingernails, it's good. I pour out a little bit. So that you have room in the top for your peroxide. Now, for every 100 cc's of saline, you use 5 cc's of hydrogen peroxide. So since this is 250, I just use 10 cc's. It's a little less than, the formulation, but it's easy to do. If you have a clean syringe, you can just use 10 cc's from a syringe. If not, most people have a teaspoon. 1 teaspoon equals 5 cc's. So you pour out 1 teaspoon, 2 teaspoons. So now you have your solution. Put the lid back on. Mix it up. And then you'll notice that this chamber unscrews. I fill the chamber halfway. Screw your mask back on. And then plug her in. And put the mask over your nose and your mouth. You should get a seal on it. So if the mask is too loose, get it so there's a seal around here. And you turn on the on switch. There's only one switch on this. It's real simple. Now, I normally do this for 15 to 20 minutes per treatment. Most of the fluid will be gone. I already showed you how to refill it. This container of hydrogen peroxide solution will keep in the refrigerator for up to 3 months. The only thing that happens to this after 3 months is the hydrogen peroxide will just turn into water. It just gets more and more dilute. So, as I said, we do this in the morning and at night in our house, at least. If I go out to Sam's Club, or if I go to, this was even before the virus came out, if I go to a dense area of people, I will come home within a half an hour of getting home. I will do this nebulizer with the hydrogen peroxide solution, just in case I came in contact with people, you know, in Walmart or supermarket or something, and cleans out. The micro mist, you'll notice there's a very fine mist. The micro mist goes from your nose all the way down your respiratory tract, into your trachea, your bronchioles, and down into the little sacs in your lung. So any place that a microbe would be able to go, this goes and kills it on contact. So good luck. One thing I forgot to mention is I put the solution in here. H2O2, 10 cc's per 250 normal saline solution. And I put the date so that you know when it was made. So when your 3 months are up or close to that, you start mixing another one. The other thing I need to tell you is everybody in your household needs to have their own mask. So the little guys get this mask. You can order a mask. This doesn't have an extra chamber. You only get 2 masks and 1 chamber. So if you have little kids, you'll have a spare mask, but order a mask with a chamber for them from Mountainside Medical. And for every adult in the family, order a mask with a chamber. They're less than, they're like $1.39 or something. It's under $2 each. So we have masks I buy for our family, and then I buy a backup, you know, to get through the winter. So that's all. Just a little extra to review so it's very clear. You can use, everybody in the family can use one machine. If you got the money, get a machine for the adults and a separate one for the kids, or whatever's convenient for you. But everybody can use the same machine. However, everyone needs their own mask, chamber, and hose that connects to the machine. This you can't share with anybody, any part of this, because it would be cross-contamination. If somebody has an infection, if you share any part of this, somebody else can get contaminated if you have something going on. So keep this separate from everybody else. You can use the same solution bottle if you'd like. We do separate bottles for everybody because everybody does them at different times. So Paul has his own bottle in the refrigerator. I have my own bottle. My husband has his own bottle. So you pull out, and it's also a way to know if you've been doing it or not. My bottles run out quickly, and so does my father-in-law's, because he does it more than me. The third very important thing is hydrogen peroxide. The dilution you want on the bottle is 3% hydrogen peroxide, okay? Nothing else, 3%. Because if you get a stronger concentration, of course that's going to mess up your dilution of your solution. So 3%, that's the one that's about $1 in any supermarket, okay? And that's all.